So the post-stroke movement disorders, they are secondary movement disorders, and it happens that if the patient develops a stroke, maybe following the stroke, they develop some movement disorders. And the duration, the onset from the stroke, like those patients suppose develop a stroke today, it's not necessarily that patient will develop the movement disorder on the same day or at the same time. Many times the movement disorders may follow the stroke weeks or months later. But some movement disorders may follow immediately after the stroke, like hemichorea, hemivallism. They may be one of the presenting features of post-stroke movement disorders. But certain movement disorders like dystonia, tremor, they appear weeks or months later of the stroke. So it's challenging that the patient who has a stroke has hemiparesis or maybe some motor weakness. But apart from that, when they are improving, they are developing some movement disorder, and they cause a lot of disability to the patient. So it's important to identify them, it's important to treat them, because if you don't treat them, they will lead to a lot of morbidity and mortality. So currently we are working on two different modalities. One is the diagnosis and the second is the treatment. So for the diagnosis, we have made a collaboration of 5 centers where we are going to provide the clinical data, and based on the clinical data, we'll be doing the neuroimaging studies. And the neuroimaging clinical correlation will provide us some clues regarding the exact anatomical localization of post-stroke movement disorder patient. And along with this, we are also working on a rating scale, where the rating scale is being developed for maybe classifying the post-stroke movement disorder, because that will be very helpful and instrumental when we will be either monitoring the patient or we are going to start some drug trial, because we require a scale and the current scales are not enough to measure those patients. So once we go ahead with this scale and we are able to validate the data of the scale, we are going to start some new treatment modalities and the trials related to that. And I am very sure that in the coming future, we should be able to get a new scale and maybe some new treatment modalities for post-stroke movement disorder patients.